I'm the Magnet Program Director for Cook Children's. American Nurses Credentialing Center created a designation. It's the Magnet designation, and it's for hospitals who display excellence, not just in nursing, but in patient care. The biggest focus is on the outcomes. So not just what we're doing, but what that accomplishes.
In 2003, Dr. Linda Aiken did a study, and she validated it in 2008 that for every 10% increase in the number of bachelor's prepared nurses that you have in your organization, you have a 4% decrease in the mortality of your patients and a 5% decrease in your ability to rescue in an appropriate amount of time. The Robert Wood Johnson Foundation helped support the Institute of Medicine for a landmark study in 2010 that was released on the future of nursing. They recommended that by the year 2020 that we have 80% bachelor's prepared nurses and double the number of nurses that are prepared with a doctorate. And the reason for that was because of the changing environment that we're in and the complexity of our patients. They felt as though that nurses need to be prepared at a higher education level to be able to meet the demands of those patients.
And Magnet has also picked that up. They're not saying we have to be 80% by 2020, but they want to see a plan of how we would get there. We can't ignore the evidence. So we really are striving to achieve that 80%.
I have been a nurse for about 17 years. I went to LVN school. I was a non-traditional student because I was a single mom. I was out of school probably 2 years and went back for my BSN, 9 or 10 years when I went back to get my MSN. Your education is something nobody can take away from you.
I was an EMT, and then I went into a surgical technology program and worked doing that for a short period of time. And then I went into an ADM program and then back to get my bachelor's. Just being able to really come to work and bring my best self and provide good care to the kids that are coming in the doors every day is what I enjoy the most about my job.
I've been a nurse now. In June will be 13 years. I graduated with my ADN in 2000, and it took me 11 years to reach my goal of getting my bachelor's degree. As a nurse, I'm always passionate about the care that I'm delivering to my patient. I want to make sure that it's the highest standard of care that's available to that patient, and I want to make a difference that day.
I went to UTA, got my bachelor's in nursing. 8 years later, I decided I was ready to go back and get my master's. We are lifelong learners. We have to be. There's no way you can be a nurse and not be learning something new every day. That's just the nature of the business.
I have been here 26 years. I've got married during my associate degree program. I had a small child when I worked on my bachelor's and a little older child when I worked on my master's degree. My last degree is my doctor of nursing practice. I have a true love and passion for nursing and want nursing to be the best it could possibly be for the profession, but especially for our patients. Cook Children's has a very valuable package that we offer to our staff. We do provide tuition reimbursement, and the tuition reimbursement will, in a lot of cases at a state-supported school, pay for the semester's tuition.
There's a small commitment, that they ask for, but I think, the rewards are more than worth the time that you're putting back in here. In the end, really ended up with no debt by the time I was done with school, and so it worked out well for me.
There are also a lot of opportunities for those nurses to go back to school. We have over 600 RN to baccalaureate programs available for nurses now for them to take, and about 400 of those have online capabilities, so that allows people to balance work and home a little better with school.
It's in short stints, so you can make it. You can see the light at the end of the tunnel soon, and you look back and think, wow, that was quick.
We also have managers that work very closely with our staff to help them with scheduling.
I think within the departments, we have to be able to be flexible and allow, people to work around sometimes the schedules that are given to them.
It's never going to be the perfect time. You may as well just do it, and you'll be so proud that you did.
I was 54 when I went back for my doctorate degree, and very busy, so it's not easy. I'd be telling a story if I said that it was easy. It's not easy, but it can be done.
Everyone has been so wonderful explaining the program. There's always someone out there willing to help you accomplish your goals.
I feel like there are a lot of benefits to furthering your education. There are pieces that you get in a baccalaureate program that you don't get in, say, an associate program. The quality improvement process, leadership development, the research.
My critical thinking skills have really increased as well, especially working in the emergency department. I feel now that I am able to grasp that knowledge and maybe move forward in my own career.
It just opens up so many opportunities for you to make changes from the other side of the table, make your job better, easier, and really making a difference in people's lives.
Plus just the personal pride. I mean, it feels like such a sense of accomplishment to have finished it, to have those other letters behind your name that you know you worked hard to get them there.
If you're thinking of going back to school, whether it's for your bachelor's, your master's, or if you happen to not have any of those and you're just wanting to become a nurse, then there's plenty of opportunities here. You just have to want it.
I think short-term sacrifices equal long-term successes, and so, you know, it's worth it in the end. And so just believe in yourself.